All right, hello again, and welcome back for part two of my interview with Dr. Tami Eggleston. As a reminder, I'm Jasmine Black, one of the enrollment specialists for McKendree Worldwide, and I'm joined again by Dr. Eggleston, who has already talked to us about our psychology program. But today, she's going to wear her hat for clinical mental health counseling program. So thank you for your willingness to talk on behalf of this program as well. And as another reminder for those, we've chosen to do this video series of interviews to kind of get great information out to you all while still doing our part in participating in social distancing. Social distancing. Wow, what a word, right?
Absolutely. We say it so much now that it's just a word we just think about flatten the curve and social distancing, all these phrases that a year ago none of us even knew what it was, and
Right?
now we do.
I think we're doing pretty good. The curve seems to be coming down, so yay us. So for those that are looking for a master's degree, why should they get one in clinical mental health counseling?
Absolutely. I think clinical mental health counseling is something that is not going away. And if anything, the need for counseling is one of those things that if you look in any of those occupational outlook manuals, counseling is always on the rise. And there's a little part of me, I sort of struggle with this where I'm like, yay, take the master's program in counseling because there's always going to be a need. I sort of wish I didn't have to say that.
Yeah.
I always feel a little bit odd that I say, oh, there's always going to be a need when I sort of wish there wasn't. But you know what? There's always going to be a need. I think there's a few reasons. Obviously, substance abuse is a huge challenge in this country. We don't know exactly why young people today are experiencing more anxiety and more depression. And then actually, there's talk now among psychologists and counselors what is going to happen after sort of COVID and what has happened to all of us that now we've all been sort of in our homes. And I think some people are really responding really well, other people not responding so well. Some people were worried about maybe their long term after this. Maybe they're doing fine now, but maybe they won't in a few months. What is this doing for marriages? We don't know. Maybe for some marriages, this has been a great time to spend together. Maybe for other marriages, not a great time. So, actually, these challenging times are probably going to mean we need even more counselors. I also think that people are more willing to go to a counselor today than they ever were before. I remember back when I was interested in psychology in the 80s and 90s, people really, if you went to counseling, you kind of didn't tell anybody. Now today, people go, oh, I go to the hairdresser, I get my nails done, and I go to a counselor. They put that in as, they go to a personal trainer and they go to their counselor.
Yep.
Many people, there's still some people that maybe aren't quite like that, but I think a lot of people today going to a counselor does not have that same, oh, you're going to a counselor. I know a lot of really mentally healthy people who just go to a counselor almost like they're getting their oil changed in their car. They just go to a counselor just to stay on a nice path. So, long
Yeah.
answer, but there's a huge need for counseling. So if there's a huge need for counseling in this country and in this world, then McKendree is happy to be able to offer a really high quality master's program.
That's awesome. So what kind of makes our specific program unique?
Sure. Well, interesting. I am going to be the interim director for the next year, and I'm so excited about it because 15 years ago, when we started this program, I actually worked with a former professor who's since retired. I actually worked with her, and we designed this program some 15 years ago.
Oh
So
wow.
sometimes people go, so you're really still interested? Why are you so interested in the master's program when you
Right.
mostly teach at the undergrad? I said, because I started it. And when I start something, I give 100% to everything I do, but especially when it comes to McKendree curriculum. So we went out, and when we started our program, we were very clear. We want this to be a master's program to help you get licensed in the state of Illinois. And what many people don't know is that to be a licensed counselor, every single state has different requirements. And actually, Illinois is one of the most difficult states. Now, some
Really?
students go, Well, I don't like that Illinois is one of the most difficult. What that means is if you are licensed in Illinois, it is very easy then to get licensed in other states because
Makes
you've
sense.
already taken the most courses, the most required hours. There are a few states, and I won't know them all, that maybe have like one course that Illinois doesn't require. So if you move to
Okay.
that state, you may have to do that. But the good news about being from a state that's hard actually means that you are more marketable to other states then. Maybe you don't feel like that if you say, I just want to live in Illinois, but there are other states that are easier to finish their master's degree and get licensed, but then they couldn't come to Illinois and do that.
Right.
Just a little FYI, that's true of hair,
Yes.
hairstylists, lawyers. I mean, there are all these
Teachers,
different states,
nursing.
nursing, right?
Right.
All these different states have different ways to get licensed, and you may not love it that you live in a state that has a hard way to get licensed, but in the long run, it's so much better for you because you can go other places.
Okay, so the licensing in Illinois, would that be the CPCE?
Yes, that's one
Okay.
part of it.
Okay.
Yeah, Illinois takes everything they do very seriously, from lawyers to teachers to counselors, and in a way, that's great. But so no, they are very prescriptive of how many
Okay.
hours the programs have to be, the exams that you have to take. Almost every state has an exam now. There's still a few that don't, though. I won't tell you because you'll try to move there. But anyways, you have hours, courses, the exam, and then even after you get your master's degree and pass that first exam, then you have to
Okay.
go out and work for a while to get even more
Okay.
work experience. So it is a relatively long process. But when you think about it, you don't want somebody doing counseling to you or your significant other or your children if they haven't gone through quite a long process. So it is a long process. You also, once you become licensed, you have to keep doing continuing education to stay licensed. So yeah, it is a long journey. So if you want to be a counselor, that really has to be something that you are, this is really in your soul that you want to be a counselor. But the good news is once you've done all that, there are a lot of job opportunities out there in different settings for you.
Okay. Cool. So definitely a passionate career, huh?
It is, yes.
Okay. Now, so for our specific CMHC program, I know we require an interview during the admissions process. What are you looking for, during those interviews?
Right. And some programs don't require an interview. When I set this up 15 years ago, we said that you did not have to take the GRE. I said, just being a good test taker, that's awesome. If you're a great test taker, good for you. You're good at vocab and math, and those are great skills to have. But some people aren't great test takers. So I was
Right.
very much against requiring the GRE to be a counselor. Some of the best people that I've ever known as counselors, I don't know if they're good test takers or not. I didn't care
Right.
about the GRE, but what I did care about was an interview. And I think that it's really essential that if we're going to bring people into our program, we also keep our cohorts really small, like 12 to 20 in each group. We want
Okay.
quality people. We want people who, I know that you understand that this is a long process. You're not going to just get 2 years and you're all done. No, if you want to be a counselor, you're pretty much committed to continuing education for the rest of your life. And I want you to know that. But I just want to
Mhm.
know what kind of person you are. And I'm going to ask you some pretty tough questions about why do you want to be a counselor? Um, are there any types of people that maybe you'd be uncomfortable working with, and why? I want to know why. I want to know what made you think you wanted to be a counselor. I want to hear those stories. And I think that maybe an interview seems scary, but what I think is scarier is going to a program that doesn't require an interview, because then you're going to be in those classes with people and you might go, well, that person should not be a counselor. And I think you can learn that. So we do ask you to write a personal statement in writing why you want to go into counseling. We also do an interview, either face to face or Zoom or Teams or
Okay.
something like that. And then we also require reference letters that we want to know that. We don't require the GRE because I don't care if you can fill in ABCs, but we are going to do an interview.
Gotcha. Well, that's great. I mean, I definitely think that that gives you quality applicants, and then that also means you have quality classmates to kind of go throughout that journey with you.
Yes. Yep.
Okay, awesome. So what are some of the interesting courses
Right.
within the program?
And again, unlike my undergrad psych where I just rant and rave because we can add sports psych and we can add
Right.
military psych. The master's program, we don't have quite as much flexibility because state of Illinois. So the state of
Okay.
Illinois has already told us many of the courses, and we
Okay.
want to make sure that you don't get done with our master's program and then get ready to fill out your licensure paperwork and go, oh, I never had this course. So most of our courses, maybe not all, but almost all of our courses are directly aligned with licensure. But I still think they're really fascinating courses. So we have courses in theory, skills, couples counseling, group counseling, career counseling, substance abuse counseling. So you're still going to see that you're getting those really specific courses so that you're ready to counsel. Our program, we would say, is a general program. Like
Okay.
you're not going to take 8 courses in child development, for example.
Gotcha.
That's not our focus. Our focus is for you to be licensed so you could work with children, you could
Mhm.
do marriage and family, you could do substance abuse. And then probably when you start to do your hours, when you actually get placed in different places, that's when you might start to say, I'm going to become an expert in substance abuse, or I'm going to be more of an expert in counseling. But our program, our courses really are very broad so that you're going to have a little bit of all of that. And then when you take your exam, you will know a little bit about all these things so you can pass that exam. That's really our goal.
Okay, that makes sense. So, I mean, you kind of highlighted some different jobs you can kind of have within
Hmm.
counseling. Are
Right.
there some areas that people don't really think about that you can kind of get into by having, a degree like this?
Absolutely. And I think, all the courses that I rattled off, those are all basically jobs. So a lot of
Right.
people do go into substance abuse. A lot of people do go into correctional and maybe a
Hmm.
foster care in those different areas.
Okay.
Social workers and counselors oftentimes will kind of compete for similar jobs.
Hmm.
So the counseling, most people who come to a counseling program have it in their heart that they want to do counseling. Now, they
Right.
maybe thought they wanted to do private practice and then they maybe get out and work in a group or in a hospital setting. What we're also finding, though, is that some people get their counseling degrees and they've really fallen in love with higher ed. And a counseling degree makes you really good as an admission counselor, makes you really
Mhm.
good in career services. So, a lot of our career service people around the world have some counseling backgrounds
Interesting.
because, in a way, when you're a student support specialist or you're a recruiter or you're working in a college situation, a lot of times having a few little counseling skills that comes in really handy. So
For
not
sure.
everyone who gets a master's in counseling goes right off into directly counseling.
Gotcha. Okay. Now I know we do a stress management clinic at least
Mm.
like twice a year. So can you
Mhm.
tell us a little more about that?
Right. Well, one of the things that I think is really great about McKendree at the undergrad and the grad level is we have the theory and research, but we always want application. And I think people who go into counseling, they just don't want to read a book all day long about how to counsel. And you do a lot of these mock things where you pair up with a friend in the class and then you do these mock counseling situations. And those are great. They're great tools to learn. One of the common things that you have to do in the skills classes, you have to find a friend or family member and record yourself doing a counseling session and then you show that and analyze that. That's all great, but they're all kind of artificial. So what
Right.
we wanted to do is set up a way for our students at McKendree in the grad program to help other students at McKendree and kind of get some real world counseling experience, but not at a super high risk thing for the clients, because you have to remember these people still aren't licensed counselors. So what we
Right.
started was a stress management clinic where a licensed counselor in the class teaches the students how to kind of help students who maybe are having some stress. And really, what undergrad student or what person doesn't have some stress? So these are voluntary times where people can come and talk to somebody. And we very clearly say these should not be extreme things. These should not be eating disorders or extreme substance abuse. That's
Okay.
not what this is for. This is like the stress of, I feel really overwhelmed. I don't know what I should major in. I just broke up with my boyfriend. Some days I just feel kind of blah. Some days
Right.
during COVID-19 I don't want to get up and take a shower. I mean, these are like a little more common
Yeah.
things. And then so our counseling students get a chance then to help other students in a little bit more of a low risk way. And they sometimes do these one-on-one. Sometimes we do them in small groups. But it's just a great service. I hate the
Yeah.
phrase win-win, but it kind of is, where our
Yeah.
students get some experience, but yet our undergrads get the chance to just get some sort of counseling that maybe they want make an appointment with the counselor, because they might be like, oh, this seems a little, I don't think I need an hour with a real counselor to help me figure out what I should major in. But meeting with these people that they kind of know that they need hours, so please, if you've got any little problem, please come see them. So it works out pretty well.
Okay. That's super cool. I mean,
Hmm.
that's definitely not something I feel like everybody has. So
No,
that's
no.
neat.
Yeah.
That's neat that we were able to do that, especially to benefit, I mean, all of our students, the actual students in the program and the students that, could benefit
Yes.
from that
Yeah.
time.
One little interesting thing where I think most of us think of all the negative with this COVID-19 time, we've all gotten so good at Zoom, and we had never really allowed that to be any kind of telehealth before we
Mhm.
made it all face to face. But I
Mhm.
kind of see in the future that we might be able to make that stress management, maybe some of these Zooms or Teams. And then I actually think students, and then that can be online students, that can be anybody, and maybe somebody will be more willing to say, yeah, I'll click online at 7 o'clock and not actually have to go somewhere.
Yeah.
So I actually think that all of us with our found skills online, we may even try some telehealth, and telehealth has just taken off
It really
amazingly.
has.
Yeah.
Yeah, I mean, I've heard about all these different kind of AA meetings that they're doing
Yes.
via online now, which I think
Yep.
is fantastic. So
Right.
anyway, I think for us to stay connected and, to get into each other's homes and kind of keep our sanity, during this
Yep.
time, I think is beneficial. So I definitely think this is going to change the way that we do a lot of things,
I
when we
do
come
too.
out of COVID. So
Right. Right.
okay, well, that's awesome. So, what kind of advice would you give someone that's thinking about, getting into this field?
Right. Well, one other thing about our master's program that I'm really proud of, we have very few prereqs. So even though it might feel like if you were not an undergrad psych major, you can't do this, that is
Mhm.
not true at all. We really set it up with basically like intro to psych, abnormal psych, and maybe one other psych. So if you're
Okay.
sitting here going, I'm in a career and I already have a bachelor's degree, but I am not happy with my career. I don't see this as something I want to do forever, however
Mhm.
that looks, but you go, oh, but I didn't major in psych as a undergrad, so I probably can't get in. That is not true. We actually really are open to kind of whatever major. And I actually taught research methods in this course in the program a few years ago. And there
Mhm.
was a man in my program who had been a police officer for about 10 years. So he was a
Okay.
male working in the St. Louis area as a police officer. And he joined our master's in counseling program because he said he was tired of locking up young men. He wanted to help young men. And
Hmm.
that just still almost like chokes me up
Yeah.
because he had been a really successful police officer. That had been his career. He was successful, making decent money, all that. But he just said that wasn't what he wanted to do for the rest of his life. And so he came back and he only had intro to psych. So he actually had to take abnormal psych at the undergrad level before he could
Mm.
get into our grad program. And he was one of the best, just most natural counselors that I've ever met. And I just know that he's gone out and helped so many young men. And the
Yeah.
fact that he'd been a police officer, I mean, he could tell them, listen, I
Yeah.
know what happens. And so it
Show
was just,
both sides.
I think that's really a beautiful story. So in our program, we have certainly a lot of people that are traditional age. They come straight out of 4-year psych programs. That's great. Those are the people that knew they wanted to counsel. But we also have a lot of non-traditional people that were in sort of non-traditional jobs. And then
Mhm.
they knew that they always wanted to be a counselor. Maybe they had to wait till their kids went to high school. Maybe they were in a job and they had to pay the bills and now they're coming back. Our program is also pretty unique that you can work and then you take the courses at nighttime. So I get that that's a lot on somebody's plate, but we did that very intentionally. So there's a lot of intentional things about our master's program. We do not have to take the GRE. You do not have a bunch of prereqs. You don't have to be a psych undergrad to get in. You can work and take our take our courses at nighttime. So we really have tried to design it for a variety of different people, and I'm really proud of that. Yeah, you can tell I still love what we did 15 years ago, and it's evolved over time. But I'm still really
Yeah.
proud of our program.
So for those prereqs, let's say somebody did do psychology like, I don't know, 15 years ago and they decide they want to come into this program. Is there a timeline on those classes?
Nope,
Or as
nope.
long
We
as
might
they've taken them at some point, they're good to go?
as long as they've taken them. Now I might encourage you to maybe like open up your old
Refresher.
intro to psych book or Google what is that DSM? What's the difference between depression and anxiety and schizophrenia?
Right.
Because we're going to be talking about those things in the program. Pretty like, hey, everybody, it's
And it could
depression.
have changed. I mean, what we're on, we're
Yes.
on 5 now?
Yeah, yeah. I mean,
Yes.
the APA manual changes, the DSM changes. So sure, things might
Right.
have changed, but I'm really proud of that we didn't say, "Oh, you have to take these 20 prereq courses or you can't
Yeah.
get in." Because I think especially maybe in Southern Illinois, there are people who never thought about going to grad school 15, 20 years ago. I know most people in my family they didn't think about going to undergrad. They sure didn't think about going to grad school. So if
Right.
you are a 40-year-old person and saying, I always wish I would have, and now my kids are grown, you don't have to quit your job. Keep working and take classes at nighttime. So,
Yeah, that's
so
definitely the
I
beauty. And I mean, I can speak to that because that's kind of what I do.
yeah, yeah,
But yeah, I mean, that's the beauty of specifically the worldwide portion of what we do, because that site caters more to your non-traditional students. So, I think one of our biggest selling features is the flexibility that we have, valuing work-life balance. So we want you to still be able to accomplish your goals while still maintaining everything else that you have going on in your life. So
mhm.
that's awesome. Well, I mean, any other cool stuff? Anything else you want to share?
No, I just wanted to say that I've been at McKendree for 25 years. I've been involved in the master's program for 15 years, and as our students have graduated, I've been able to see them go off and work in their different counseling centers. And then now when I have students or families come to me and say, "Can you recommend a counselor in this area?" I love it because I've known some of these people since they were undergrads, and then they maybe went to grad school and I met them through grad school. So it really is neat now that we have this whole network. And then I have been really fortunate. My undergrads, when they need to maybe go shadow or get experience, they can go see what the master's students are doing. So we've also built kind of a really interesting network of McKendree counselors in this area.
Yeah,
So when people ask me for references, I'm like, "Oh, are you ready? Tell me what you need, because I've got 100 counselors ready to go here. Tell me what you're looking for, and I can probably help you find a good counselor."
that's awesome. That's super fantastic. Well, again, thank you so much for your time and your knowledge that you have shared with our McKendree family today. And again, a shout out to all of our worldwide folks turning in. And just keep an eye out for our next video in the series. We're going to keep doing these, and you'll get an opportunity to see our student service specialists kind of talk more about the admissions process and kind of registration, because that's kind of their wheelhouse. And then talking with different program directors and faculty so they can really tell you some of those neat details about our courses and the programs, and just make what makes McKendree unique. So thank you again,
Thank
Tami.
you.
I appreciate
Thank you.
it.
See ya. Thanks.
Stay safe and healthy to everybody out there. Take care.